Welcome to Beyond the Limits with me, Matt Clark.
And me, Mike Forsyth. Today we're talking about skin, and rather than focus on a particular medical condition, which we might arguably know a little bit more about, we're taking a leap into the unknown and talking generally today about skincare.
We've been joined by Dr Ari Rafiq, a GP and dermatologist, who now practices at the clinic at Holland Park, which is based in West London. Dr Rafiq shed some light on the hundreds of products claiming to give you dewy, glassy skin.
ChatGPT reliably informs me that the skincare industry is worth almost $200 billion worldwide. But where do you start? Can you, as I like to think, slap on a bit of moisturiser and hope for the best?
And what about the lotions, potions, serums and lasers? Let's find out, shall we?
Dr Ari Rafiq, welcome to Beyond the Limits. Thank you so much for joining us.
Thank you very much for having me.
So, we are talking about skincare. And I guess for me, skincare is a slightly vague and all-encompassing term. And it also feels like a bit of a minefield. There are thousands of influencers doing YouTube skincare tutorials. They're promoting things that they've been paid to promote. And it really feels as though it's that blurring of the lines between beauty, perhaps anti-aging, and healthy skin. So we're delighted to have you, Ari, because I'm hoping that we're going to be able to delve into that in a little bit more detail. So I'm going to start us off really basic and just talk about what the fundamentals of good skincare look like.
Well, thank you so much for having me. If it's okay, I'd like to just start off with a bit of a basic science lesson, because I think that will really stand us in good stead going forward when we discuss the next few steps. If you think of skincare like a trifle, so in different layers, the bone, so your skeleton, is your scaffolding. So it starts right at the bottom and everything is lying and basing on that. Above that, you have your fat layer. So that's nice and plump and juicy when you're young. And as you get slightly older, it gets thinner and starts to wear away. And that's why we get the sagging and people start to feel more hollow. And that's why they want to look more plump in certain areas. That's particularly enhanced in places like the face, where your cheeks start to really fall back and thin back. And that's why, because your subcutaneous layer and your fat layer is thinning out as you get older. The next layer is the dermis. So that gets slightly to nearly the top of the trifle, which is the exciting bit where you've got lots of collagen and elastin and loads of blood vessels, nerves, loads of activity going on in the dermis. And you will only really reach those layers of the dermis with injectables and things that really go through. So there's no cream, unless it's a really strong prescription strength or stripping or laser. There's not much that will go near the dermis. And then on top of that, you have the cream layer of the trifle, so the epidermis, and even that is split into two. So the bottom bit of the epidermis is the living bit, which has all your melanocytes. All the skin cells are made in the bottom bit of the epidermis. And as they get older, they rise up. And at the top is the tough bit of skin, and that's the bit that you see. From the bottom, where it's really healthy and alive, to go up to the top, lasts about a month. And as you get older, that slows down and you get more of the dead cells hanging around, which is why the skin looks less glowy and it can look a bit more dull. And that's when your skincare really kicks in. So if you just keep that in mind of your layers, then you know where you're treating and you know where your skincare is working and what it's doing. So go back to your original question, what are the good fundamentals? The number one thing I've written for fundamentals is consistency. So you've really got to be consistent with skincare. There's no point washing your face once a week and then putting on £200 moisturizer the rest of the week. It's not going to work. You don't need to make it complicated, but you need to be regular. You only really need 2 or 3 minutes twice a day just to dedicate that time to really cleaning your face. And that goes on to my next key thing, which is washing. So washing your face is so important and is actually something that's really commonly missed by patients and clients and, people generally. So
Doctors and podcast hosts and
everyone. So splashing a bit of water on your face first thing on the morning or last thing at night is not going to do it. So pollution is everywhere. Dirt in the air is everywhere. Hopefully everyone is wearing sun cream, so that's everywhere. And then at night, most of us sweat. Those skin cells are constantly turning over. Your skin doesn't sleep when you're asleep. So that's all that process is happening. So you need to wash off the dirt, the dead skin cells, and any makeup or products. So it needs to be a cleanser. That can be in whatever form you want. Balms are really good, oils, gels, and you need to really wash off the dirt that's on your face, particularly if you have conditions like acne. But other things as well, eczema, you need to wash your face. People think, oh, you mustn't wash. You absolutely do, because there's dirt everywhere and we need to wash. So water is not enough. Ideally, it's cleanser and a flannel. Definitely no wipes. Makeup wipes are a huge popular thing. They're just moving all around your face. Some will come off on the wipe, but it will never actually clean. So if you think about your clothes, if you're rushing out and you've got a little bit of a toothbrush stain, you might just wipe it down with a wet cloth, but it's not really clean. It's the same with your face. You need to put it in the washing machine, put the cleanser, put the soap on, and that's what will clean your clothes. The same with your face. If you're desperate and you're in the middle of a field and you're camping, okay, you can use a wipe, but generally we want a proper cleanser.
I was just going to say, I can feel my wife rolling her eyes at this moment and saying, "Told you so." Because every evening when she's washing her face, and I'm just kind of brushing my teeth, being like, "What? This routine you've got, is it totally necessary?" But I think if you were to tally up who has more spots and blemishes, it's definitely me. Yeah.
Yeah, I mean, I have to say, my husband does not use a cleanser. He will be very cross at me for saying that, but I think it's just not a thing that men think they need, but they definitely sweat more. They've got 3 other really key things. SPF is key. You've got to cleanse, but if you do nothing else on top of cleanse, you've got to put SPF, because there's nothing else you will do in your skincare, be it injectables, be it lasers, be it topicals, that will be as anti-aging and as effective as SPF. And we say that from basically 6 months onwards. So I'm talking 6 months babies onwards, there is no reason why you shouldn't be wearing SPF. Loads of people find they have allergies. That is a very common thing. That's true. You've got to just try loads of different ones until you find the one that works for you. I would love everyone to wear a factor 50. Most people will probably compromise at a 30. Some people will say that there's factor 15 in their foundation and they make their dermatologist cry on the inside, because that is not doing very much for you. Another one, please don't smoke. It's really, really bad for your skin, and you get all the wrinkle lines around your face. And actually now they're saying there's things they note in cigarettes that actually accelerate aging. And the last one is eat well and drink well. There's a link between diet and skin is so inherent. It's not that if you drink loads, your skin is perfect, but if you don't drink a lot, the dehydration will not help.
It's great to get a rundown of the basics there, and I really like the trifle analogy. I'm just remembering when I had a hammam massage earlier this year in Morocco, and I felt like at least 2 or 3 layers of my trifle were kind of ripped off, and I was thinking afterwards, like, was this in any way good for me? It was kind of relaxing in the moment, but I don't think my trifle appreciated it. Just moving on then. We're aware of, there's so much. I mean, researching this episode, there's just where do you even begin to start? There's so much in terms of various treatments, novel therapies. Some of it sounds pretty wacky, some of it sounds more legitimate. I'm going to start off with these polynucleotides and the skin boosters, these injectable treatments that I looked into. Now, I pulled off this quote, and it was polynucleotides are naturally derived molecules that play a crucial role in stimulating cellular activity, promoting collagen production, and facilitating skin rejuvenation. Now, I mean, that sounds absolutely amazing. That sounds wonderful. But am I right in thinking this is essentially injecting small DNA fragments into someone's skin from a purified fish DNA? Am I right?
Oh yeah, so that you've hit the nail on the head, that this is the very, very popular salmon skin facial that everybody's talking about now. So exactly that. So it's use of small chains of DNA that they're injecting that has an immediate sort of filler effect because of what you're injecting in. So anytime you put a needle in, it will plump things up, and then it gets to work. Their use in aesthetics is quite novel, and the difficulty with aesthetics is a lot of the published data is sponsored by drug companies. There is a lot of conflict of interest, and there's very small cohorts. So sometimes we're publishing papers that have 5 patients. And, when you think about the numbers of patients that are being injected on a daily basis, that's quite small numbers. But there's a lot of case studies. There's a lot of people using them. There's a lot of positive feedback. And actually, if you think about exactly as you said, how it's working, it's stimulating tissue growth, is enhancing the blood supply, it's reducing inflammation. All of these things are good for skin, but how long it lasts, I'm not sure, because you do have to have repeated treatments. But in terms of wound healing things, we do have good data. So if you extrapolate it from that we've got good data on wound healing, diabetic foot ulcers, a lot of post-surgical wounds. There's a surgeon in South Africa that did a lot of wound healing data on polynucleotides, and that's how it came out. So it's the essence of it is it was all started in wound healing, and it's been extrapolated from that.
Okay, that's interesting. Am I right in thinking there's a distinction between polynucleotides and skin boosters?
Yes, polynucleotides are the DNA fragments. That's the salmon skin facial. And then you get other skin boosters, which there's loads of different names on. So things like Profilo, you might have heard of. That's quite a popular, famous one at the moment. So that's hyaluronic acid. So they're boosting the skin, they're injectables into the skin. So quite often, if you go into a clinic, they'll be called injectables rather than boosters, or some places call them boosters. So Profilo is specifically hyaluronic acid, but they're trying to differentiate them from fillers. So these are all injecting things that will encourage plumpness, elasticity, collagen, as opposed to just replacing filler and fat. So hyaluronic acid, but hyaluronic acid degrades very quickly. So Profilo, you have to repeat a number of times. But they do work. But one thing to note is polynucleotides are not approved in America. And a lot of things are approved in America that we don't do. So it's one thing to just be aware of.
You alluded to a lot of these treatments have only had studies that have been done on very few people. How is all this regulated?
If you go to a lot of countries, particularly the Emirates or the United States, you cannot go down the high street and just get Botox from anyone. It is doctors only. In the UK, it's not like that. We're in a difficult position where we've got loads of people offering things that aren't necessarily qualified to do, and particularly not qualified to deal with the complications. And we're now trying to retrospectively regulate, which is very difficult. So there is a level 7 aesthetics qualification, which isn't compulsory. And, that's fine, because you can get consultant dermatologists that don't necessarily have that, but are extremely experienced, oculoplastic surgeons, maxillofacial surgeons who know their anatomy. They don't necessarily need to have this specific qualification. But that's a good bar in terms of people that don't have that experience. But there's a lot of black market in this country of people getting Botox. And, the GMC actually has cosmetic guidelines, which a lot of people aren't aware of. That say, you should only prescribe Botox for patients that you see and have counseled. So then how are all these people getting Botox in beauty clinics that have not got doctors there? So I would really, really encourage, I know it's a lot probably cheaper to get it done on the high street, but if you have any complications, which we do see, I was at a teaching session a few days ago, and there's a case where someone injected filler near the eye and the patient went blind because it went into the wrong space, and that was it. And you can put hyaluronidase in and try and dissolve, but you're never going to get close enough, and you're never going to be quick enough. So although you might save a little bit, you put yourself at a huge risk. So the UK is really behind in terms of our litigation and in terms of our registration of these things, but we do have a lot of excellent experienced practitioners and clinicians. You've just got to make sure you see a clinic that's got a doctor in it, would be my advice.
So Matt's got us started on a few of these specific treatments, so keen to pick your brains on a couple more if that's okay, and we'll move through them. But let's move on to microneedling. And actually, microneedling we touched upon in a previous episode in terms of hair loss and being a treatment for hair loss. Am I right in thinking it's the same principle, that we are essentially needling the skin to sort of promote healing? Is that correct?
Yeah. So hair loss microneedling is exactly the same as facial microneedling. You're injecting the skin to promote, in a controlled trauma, to encourage all your cells and everything to go to that site of trauma, to encourage regeneration in that site. So it works very similarly in terms of the hair loss way, in that you do it all over. You do controlled needling at certain depths. And it varies patient to patient and on their reaction. You usually need about 6 treatments to get a proper full course. And then there's add-ons in terms of you can add on topicals, serums and things. People think that once you've now created these potentially, if you imagine like hole punching, if you put these holes into the skin or through your epidermis and into the dermis, if you then put the serums or the acids or everything in on top, then it's actually penetrating through. It can be used as a standalone treatment, but it can also be used as an adjunct to others. So you can do that, and people can do it with Botox and other things as well.
Should because we looked into this, and that you could buy these devices from the internet, or obviously go and have it done by a professional in a clinic. Can people safely do this at home, or is this something that they should be definitely going to the clinic for?
I would say not. I would say don't do it at home. What we said about controlled trauma is actually really important. So it depends. So the devices that you use in clinic have normally been robustly tested. So things like Dermapen, Skin Pen, they're things that are FDA approved and things that have been safely marketed. They have specific lengths and depths of needles. When you're buying devices over the counter or buying devices online, the depth of the needle is really important, the sterility of the process. So how clean are these needles? And actually, you could be doing a lot of trauma if you're dragging rather than or stamping or doing the wrong technique. You have to undergo training to do these things to people's faces. So if you're doing it to yourself, then, and derma rollering is really popular for hair. You see a lot of those people with those roller devices. But then if you're thinking about it, if it's a roller, you've put a hole in one place, it's rolling, and the same needle is then going in like sort of a few centimeters further down the line. It just doesn't feel brilliantly clean or sterile. So I think you actually run the risk of introducing infection and actually causing trauma, which instead of creating rejuvenation will cause scarring, and scarring can be much harder to treat further down the line.
That makes sense, because I was thinking the skin is going to be different thicknesses as well in different places. So if you've got set needles...
Exactly. So when you do the training, you do a certain amount of training for the cheek, not training, you do certain depth of the needle for the cheeks, and then a different length for the forehead, and then the nose is different, then around the eyes is different again. And it's not only different depths of the needle, it's different amounts of pressure, and it's per patient. So you've got to know the reactions to look for. And if you don't have all this sort of data, it seems really easy. You see all these things on Instagram of just like, oh, just rub it on or just dab it on. And it just, it's a few needles, it's fine. But actually, there's a lot more to it. And if you buy a device that's only got a fixed needle depth, either it's not going deep enough all over, or you might be going too deep in the wrong place.
That's really interesting. Okay, right. I've got a beauty for the next one, because this has been in the news recently. This one really does capture the imagination, because there are these face masks, these glowing face masks that look a bit like something out of Star Wars. But my quick view of the evidence, these look quite promising or quite interesting in many ways. And I guess I'm aware that there's a whole range of these now. You can buy these on Amazon. You could go to a clinic and have it done. Are you able to just give us a quick rundown of what these masks are and what they're actually doing?
Yeah, definitely. So LED light masks, which initially, as you say, when they first started with face masks, but now I'm seeing hair masks and headbands and eye masks and all sorts. So they're basically light masks that people are targeting for things like acne and hyperpigmentation initially, and then now it's gone on to cosmetic concerns, so anti-aging, wrinkling, fine lines. And so the data is there particularly for hospital grade or clinic grade devices, and it's anti-inflammatory. The light stimulates the skin cells after repeated exposure. So that's the thought between having these devices, that if you keep exposing your skin to these lights, it's something called biomodulation. The skin absorbs the light, which then causes cellular changes. You get new blood vessels, collagen, elastin going into that dermal layer. So that thick, healthy layer we were talking about. It encourages that to regenerate. And then the other thing it does is to reduce the inflammation and reduce the oil, which is the thing that's really good for acne. So that's the blue light, which is really good for acne. Red light is more the anti-aging and collagen. So there's some devices that will just do red light. There's some devices that will just do blue light. And there's some that will have both. LED light masks do work, and there is evidence for them. There's less evidence. I couldn't really find any trials of home masks. And the reason for that is, I suppose, it depends on the strength of the bulbs and the number of them and how close they are to the face, which is a hard thing to regulate in a clinical trial when someone's doing it at home. But a lot of these things which we're talking about, with LED lights and polynucleotides, a lot of them have started in a scientific background. So this is the one that was first tried by NASA in the 90s for the cell generation to see if there was a way they could promote wound healing, promote muscle regrowth and things like that. So they are all based in science, but then how much is a light that's 40 pounds really going to be improving your skin? It depends on the number of bulbs, depends on the number of lights. But these devices range from 40 pounds to 1,500 pounds. So that's a lot of money to pay out for something that we don't know how much it will work. So we know that light treatment works, but how much specific devices, we don't know.
It's really interesting, the point about the extrapolation, because I think that makes a lot of sense. Because, as you say, when you look at the evidence of these, you think, actually, you know what, there is some quite good evidence of the treatment. But then actually that doesn't necessarily mean that a 40 quid item that you can buy from Amazon is going to have the same effect. But that's how they're selling it, presumably. It's based on data that's got a little bit of evidence behind it.
Yeah, exactly. So there is evidence, but is the evidence for that specific device you're using? When we did COVID and we were taught how to put on our mask properly in hospital, is everyone wearing their mask the same? Probably not. It's the same for the face masks. If you're putting something on a medical device on wrong, and it's not going to work properly. It's the same for this. No one's at home with you checking. I'm also a big believer of patients can do things if it's not going to harm, and if they really want to do it, that's fine. If something's going to harm you, then it's a hard no. If it might help a bit and you've got a bit of disposable money to try it, or you want to try it, then that's fair enough and that's fine. The thing I would check is it's got an EU safety mark, and they've got a good density of bulbs, and it's got the wavelengths that you want. Just because something is expensive does not mean it's better.
And just going back to the trifle analogy, so you talked about the red lights and blue lights. These are relatively safe, aren't they? Because they're not penetrating deep into the DNA containing layers of the skin. They're not going to cause what we typically understand as sunburn. But I'm just wondering, are there any risks for, say, if someone got a home device and was just using this maybe like 2 or 3 hours a day rather than the recommended 20 minutes a day? Are there risks from these machines? Are there certain skin types that should not be going anywhere near this?
So these devices, proper devices, cut out the bad UV rays. So they're not like sunbeds. So if they're unregulated or people use them again and again and again, they're going to actually end up getting melanoma and things like that. They cut out the dangerous rays. What you said is true to an extent. So the blue light, which does the acne, is very superficial, and it activates the free radicals. It's anti-inflammatory, and it works on the top to kill the acne bacteria. So it works on a shorter wavelength. So you're trying to get rid of that P. acnes on the skin. The redder ones go deeper, and they encourage the collagen and the blood, and so they penetrate deeper. But they've said that they cut out the dangerous rays. I don't know how long we have to be using things to know. Like with medicines, we use them for a long time, then we realize, well, it works okay for that, but it's got this massive side effect. You have to be using things for 10, 20 years, and that goes with a lot of the medicines we use. But if something makes you feel better, and it might help a little bit, and it is a bit anti-inflammatory, and it's a bit of self-care, the mental capacity of that as well is probably important. If it's making someone feel a bit better and they're doing something for themselves, as long as it's not doing harm, I think it's probably fine. But in terms of if you're relying on that to sort out a deep skincare problem, I'm not sure that's where I'd put my money.
Definitely. Let's move on to serums, and we could talk for hours about this, but in terms of, it feels like there are hundreds of these. So there's the vitamin C, your niacinamide, salicylic acid, there's the hyaluronic acid that you mentioned already. Where do you start with these? What's helpful? Which ones to avoid? Can you give us some basic tips on this?
Yeah, I can definitely try. If you think about our sort of trifle layer, skincare is kind of the same. So cleanser is your number one. You've got to start off with a clean canvas. So cleanser is your number one. And then the next step in terms of your layering, people do spritzes and toners and things like that. So the best way to think about it, if you're not sure what to do, is start with the thinnest, whatever feels the thinnest in your hands, and then go thicker as you go up. So normally you start with something like an acid. So a lactic acid or a salicylic acid or a glycolic acid, and these are exfoliants. So they help to resurface the epidermis, slough off the dead skin cells, and also our skin is acidic anyway. It's sort of 4.5 to 5 pH. When the skin gets more alkali, that encourages acne to grow. So you want our skin to be slightly acidic. Where people can go wrong is when they start doing at-home things and putting, vinegar on their face and burning themselves, and you go a bit too acid. But we will come back to that. So some of these acids, so glycolic, lactic, salicylic, they're really good. They keep your skin at a good pH. They can make you look less dull in terms of resurfacing some of that top dead layer of skin. And they can help to rebuild collagen as well. And then the next step is your serums, which have got all your nice actives in. They're marketed as anti-aging. Don't love that word. I think aging is a pretty good thing if you're able to age, but I think we should think of them as our active layer. There's so many ingredients, as you alluded to. You've got your vitamin A's, your vitamin C's, your niacinamides, your vitamin E's. Where do you start? The answer is not all. The answer is depending on what you want to treat and what other things you're using. So, and it also depends on your age. So if you're young and you don't smoke, you eat well, you drink well, you stay out the sun, how much need do you have for retinol? Probably not loads. As you get older, your need for the retinol will definitely go up, and almost certainly once you get sort of 25, 30s, 35, you definitely want to be putting a retinol in somewhere. Acids is your sort of prep, and then the serum with your actives in is the next step. What you put in that serum depends on what you want to target and what you want to do and what your main skincare concern is. That doesn't mean that you can't change it around and have one for the morning and one for the evening, or use one 2 days a week and another one 3 days a week. That's absolutely fine. Or not at all. If you're not that bothered about skincare and you just want to keep your skin clean and fresh, you don't have to. Those acid serum layer is optional. It's like fillings in a sandwich. If you want to put those bits in, great. If you don't, that's fine too.
You mentioned retinols, Ari. I can't remember who told me this, but someone said the other day that that's the one to use. And I know we prescribe these occasionally in GP land for acne. Am I right in thinking you can buy it over the counter up to about 2% strength? Can you elaborate a little bit about what retinol does, what's the aim of this, and whether there are any risks of that?
Retinol is amazing. It is brilliant. It is on a par with SPF in terms of how good it is. You can tell I'm a fan. You're right, we do prescribe some in GP, so some people might know it as adapalene or differin. That is a vitamin A derivative. It's not a typical vitamin A, but it's a similar thing, and it works really well for inflammatory acne. Some patients find it stings a little bit, or it causes a little bit of peeling. That's what it's supposed to do. It's taking off that dead skin cell layer and regenerating the skin. And so there's sort of three real classes of retinoids. There's tretinoin, which is the top of the pyramid, gold star, prescription strength, will really make your skin peel and go red. So you've probably seen those things on the internet where people got a retinol peel. So their skin basically looks like it's sloughing off. That is, in the first 4 weeks of using it, you get a really good peel. And then after a couple of weeks, you'll start to look nice and glowy. But a lot of people don't want to go through that sloughy phase. You can't cover it with makeup. You can't cover it with moisturizer. You just look like a snowman. It is constantly peeling. And it does get sore. There's no way around it. But it depends if you want to, if the end game is your prize, then that is worth doing. But you will only get those either, it used to be you could only get them from a dermatologist. Now there are the online ones, so sort of Skin and Me, Dermatica prescription, online prescription ones. There may be others, but you don't have to see a dermatologist, which I think is a good thing, because before people were very limited. A private consultation is quite prohibitive, but actually if you just want tretinoin for a bit of anti-aging, you don't necessarily need to see a dermatologist for that, and they can add in other things which will support the skin. The next layer is retinal, which is almost as good as tretinoin, but not quite as strong, but doesn't need a dermatologist prescription. So these are your really strong over-the-counter retinoids. They will also cause a peeling, but the degree of irritation is less because it's not at a prescription strength level. And then the final step is below that is retinol, which, as you've alluded to, comes in varying strengths over the counter, and some of the skincare companies actually do like a formula themselves where you go to step 1 and it's the lowest step, and then step 2 and then step 3. So they step you up as you've got used to it. And the theory is, as your skin gets used to it, then you can go up to the next strength, and it reduces the degree of peeling. But normally they can be quite irritant because they're not buffered with other things, so they can be quite irritant. Retinoids and SPF in America are the only things that are allowed to be marketed as anti-aging, because they're the only things that have got the research backing to say these are truly anti-aging. But they can be quite irritant, and a lot of people don't tolerate them or don't want to tolerate them. So if you want to go for a weaker formulation or mixed in with moisturizer, they will work, but it just takes longer, which is totally fine, because you don't need to get to the end point quicker, but it does work, and it has got a lot of evidence behind it.
I'm aware that there's various different types of exfoliation, these chemical peels. I'm aware of someone, I probably shouldn't name their name, that is signing up to this CO2 laser ablative therapy in preparation for a wedding, or at least I think they are. Is that a similar process? Is that just stripping back dead skin? Is that the underlying principle there?
No, I'm not a laser expert. I'm not professing to be, but I think that actually goes a lot deeper. So you can get non-ablative and ablative lasers, but the CO2, from my understanding, does go deeper, and actually promotes new cells but it does also cause the inflammatory, that you get a very dramatic reaction with CO2 laser,
Got it.
where you go very, very red and you do get the peeling. But I think it does go deeper and actually promotes and encourage cellular collagen and elastin, which is what makes you sort of nice and plump. But the peels, yes, going back to slightly to what you said about the peels don't make you younger. They just peel away. As we said, the skin, as you get older, it slows down, and sort of the older skin hangs around and looks a bit more dull. That peels away the top layer. And chemical peels do work, and they are very effective. You can do micro needling with peels as well, so that they pierce through deeper and they penetrate better. But it's really got to be in the hands of an experienced clinician or practitioner, because the risk of acid burns and things are very high. So for acne scarring or resurfacing, peels do work very, very well. But you've just got to make sure you go to the right person. So yeah, CO2 laser is really good. In fact, all laser, ablative laser, fractional laser is really a really interesting and involving field. So it was, Botox is the one that's been around forever. Now, actually, in a weird way, skincare is becoming much more popular and people are much more aware, and lasers and things they're sort of people becoming more aware of them. They say winter is really popular for laser because you're not out in the sun. So they call it laser season. So in the winter, people go out and get their laser done. And then in the summer, they come out and they're nice and glowy.
Now, my next question, and I've been dying to ask this to someone in the know for a long time. I have various arguments with my wife about the price of moisturisers. A very topical one recently was me buying one from Sainsbury's. There are other supermarkets available, but I bought one from Sainsbury's, which apparently didn't quite cut the mustard.
Was it actually moisturiser, Matt, or did you just buy some salad cream or something?
At least, I mean, it was from the skincare aisle, but this didn't go down very well. Now, what I really want to know is, are expensive moisturisers worth it? What is it about the expensive ones? And I guess that's with a broad brush that makes them worth it. Is it more expensive the better?
Definitely not the more expensive the better. Moisturizer is a really interesting product in terms of it's marketed so well, and everybody's always telling you, your GP, your parents, your wife, you need to moisturize, and you do need to moisturize to seal in all the hydration, and also if you put in these acids and serums, you need to seal it all in. But if we go back to what we talked about in terms of the sandwich of, you've got your cleanser, you've got your spritz, you've got your acids, you've got your serums. Once you've got all those things on your skin, how much is your moisturizer penetrating through? I can't take ownership of this, but there's a very, very brilliant facialist and skincare expert called Caroline Hirons, who's very famous. And she always says the moisturizer is the coat. So you can have a nice coat, but really everyone looks at the outfit when you get to where you're going. So moisturizer is important, but it's not the thing that I would spend the money on. I would spend the money on the serums and the acids because that's the one that's closer to the skin. It's got the actives in it. If you've got a moisturizer, what is in it that's making it expensive? If it's an active like a vitamin A or vitamin C is very unstable. It needs to come in a dark bottle, which a moisturizer won't. So it's already degraded by the time you've opened the tub. So it depends what's in the moisturizer that's making it expensive. And probably what's in that moisturizer needs to be in your serum, and you can use a moisturizer. However, as you get older and your skin is thinner, you need more help. So putting a moisturizer on that's got a few actives in is probably not going to harm, and it might support a bit more, but it's not the place in my routine where I would recommend spending the money. So I also buy my moisturizer from another lesser known supermarket, but I don't think it matters for moisturizer. But I think maybe in 20 years time, maybe I'm being a bit too kind to myself. Maybe I'll spend a bit more on it. If it depends what you want to get out of it. If I think of moisturizer as the sealing everything in, and you want to get all those good acids and serums in, if you're not using acids and serums, then you probably would want to spend a bit more on your moisturizer. But I think if you're that bothered about what you're putting in your moisturizer, you probably should have gone to the serum stage. So, and most other things, so SPF in moisturizer is no good. So not at all. So if you have anything active in a moisturizer, as soon as it has SPF in it, that's knocked out all your actives. So don't mix. So you can have an SPF and use that instead of your moisturizer. That's fine. You can't have a moisturizer and use that instead of your SPF.
It does make sense. I'm just disappointed. I was feeling quite smug about the fact I'd brushed my teeth and put a moisturizer on with a bit of SPF in, but
that's all right, because you're probably not got like your niacinamides and your like vitamin C in your moisturizer, but I'd rather use the thick SPF and skip the moisturizer, or even both, put the SPF on top.
Ari, before I go and scrub my face to within an inch of its life, I just wanted to ask a more general question, and thank you for running through all of those in so much detail. Just wanted to come back to what we talk about a lot in this podcast, and that's the risks of social media trends and fads, and just wanted to get your opinion in terms of what the myths and misinformation around skincare that you come across frequently or is said to you, or that can potentially be causing harm.
Yeah, so skin talk is a huge thing. So there's a lot of targeting of preteens on TikTok and other social media platforms, and I think it's good for children to have an awareness of the importance of washing your face, the importance of SPF. The Australians are brilliant at that, at getting their kids to put on the SPF, and you're not allowed outside, and they've got these big things at the beach, and so I think that's really important. But I think if you go the wrong way, we've talked about a lot of these things like acids and active ingredients, and I hope it's come across that most of these things are for people, definitely adulthood, but if not later. And as you get older, you need a bit more things as your fat thins and your bony architecture, your scaffold thins out and hollows. You need a bit more support, and that makes sense. When you're in your preteens, you've got loads of collagen and elastin. Your skin is amazing. You don't have any pigmentation. You don't have any redness. Yes, you might have a bit of acne, but there's things you can do for that. But the problem is when children are buying things with acids or retinols in them, which a lot of them are buying because they don't necessarily know what they're buying, and then they're getting this irritation or reaction, compromising their skin barrier, causing eczema, flaring acne, and actually causing a problem where there isn't one. So it's gone from actually none of this is like, oh yeah, I'm really good at putting my SPF on. They're like wanting to use creams and skincare fridges and things like that you don't need, and they're using acids and retinols and preteens that they just don't. If you're under 25, do not worry about a retinol. Do not worry about it. I think that is the worry with children, that they don't need a lot of these active things and they're getting exposure to it. In terms of skincare myths that people are really shocked by, the fact that you need to reapply sunscreen. So every 2 hours, which is not necessarily practical if you're wearing makeup, but every 2 hours. There's no once a day sunscreen doesn't exist. It's marketed as such, but it doesn't exist. So there's Factor 50 will give you 50 times the protection, but there's no sunscreen, there's no SPF that's fully waterproof. So if you've gone in the swimming pool, you need to reapply. There's no SPF that will protect you. You need to reapply every 2 hours. Contouring, that's Gwyneth Paltrow's fault. Have you seen that? The SPF contouring, so you get the tan in the right place. Terrible. Do not do that, please. Cover your face like you would a full cream. So don't just put your SPF in targeted areas so you get nice tan in certain places. There's a big trend on DIY or natural skincare. So I think natural and clean skincare has a lot to answer for. So people are really worried about toxins and chemicals. Water is the most natural substance in the world, and if you drink too much of it, you will die. If you eat an apple with the pips, some people like eating the pips have got cyanide in them. If you eat too many apple pips, you'll die. You know, there are lots of natural things that become toxic in excess, and most medicines and medicaments are based on plants and things, so they are rooted in nature, but they're tried and tested, which is what makes them medicines. If you're making SPF from beef tallow, or you're making I see so many people that make their own SPF. What trial has that been in? How have you tested that? That is not safe, and that is not going to protect you from skin cancer. Another one is for acne. Oily skin doesn't need moisturizer. It really does, but it needs a different moisturizer. So you need a very thin moisturizer just to sort of protect your skin a little bit and get a little bit of hydration. But if you strip it back and put no moisturizer on it, your skin is really crying out for it. It thinks I've got no hydration. It overproduces the sebum and oil, and then you get more acne. Pores. Pores are not doors. They don't open and close. There's nothing that you can do that will make them open and close. They may look a bit bigger, they may look a bit smaller, but you can't get rid of them. Your body's there to help get rid of the sweat and the dirt. You can't open and close your pores. And there's nothing in everything we've discussed that's going to fully 100% get rid of the problem that you're worried about. There are lots of things you can do that will make things better, but nothing is going to 100% get rid of anything completely. But there's a lot you can do to move things in the right direction.
So drawing to a close here, I've been dying to ask about two last treatments that I've heard about. One is this melanotan, this nasal spray, and the other one was this idea of women are getting their own kind of menstrual blood and kind of smearing it into their skin and things. I mean, I've read about this. Have you heard of anyone doing this? Are either of these... I've lowered the tone. Goodness me, Mike's face is saying cut. But yeah, have you heard of either of these? Can you comment?
Melanotan is... it's so bad. It's so bad. It's so illegal and it's so bad. I don't know anywhere that it's legalized. So basically, for people that don't know, it's a nasal spray. I think you can inject it as well. There's an injectable substance which people can use to inject to increase the amount of melanin, which is the pigment cells in the skin, to try and encourage getting a tan in a different way to sunbeds. There's no trials or safety data at all. The Cancer Research UK has come out saying they're just so dangerous and they're so bad and please don't use them. And I actually read a case report today about patients that have used them that have been found to develop melanoma after using them, and severely dysplastic nevi, which are moles that have become atypical that can become precancerous. They can make the moles that you've got bad. They can make you get more moles. They make your moles darker, and they increase your risk of melanoma, which is our most lethal skin cancer. And there's no guarantee of a tan anyway. There is no such thing as a safe tan. I should have said that in the skincare myths. There is no such thing as a safe tan. People say, doctor, I don't go pink, I go brown. You're still that. Tan is your body's reaction to insult, to UV damage and radiation. So some people with fairer skin types will just go pink. That's their sun. That's they have a pink skin reaction, and that's how their skin reacts. And if you go brown, you get a brown skin reaction, and that is your body crying out saying you're damaging your melanocytes. So the UV radiation is activating those melanocytes, and they're trying to mop up all the damage, but there's only so much they can do. And when you're younger, you may get a healthy, what you deem a healthy glow, and then in your 40s, 50s, 60s, you get skin cancers, melanomas, BCCs, SCCs, and we're seeing younger and younger patients with melanoma. And so there is no such thing as a healthy tan. Sunburn is, because we're all traveling so much more, is so much more prevalent. So you don't need to peel or blister for it to be bad. If you go pink a little bit, that is a sunburn. And if you have more than 10 of those in your whole life, you're deemed at high risk, high UV risk. Most of us have had that before the age of 20 now, compared to in our parents' generation when they used to go on holiday once every few years. People now go on holiday every annual leave they get. So our skin cancer rates are going up compared to our Australian friends who are going down. And actually, we are almost reaching our Australian levels of skin cancer, and our melanoma deaths are actually higher because we're so bad at our SPF and sun protection. God. So sunbeds, I mean, they have banned sunbeds. All it does is give you skin cancer. So I'm so anti-sunbeds, but you won't find a dermatologist that thinks they're a good idea. So tanning is bad, burning is bad, melanotan is bad, sunbeds are bad, and we need to be more like Australia and wear loads of SPF. Oh, and I've never heard of anyone rubbing menstrual blood on their face.
Ari, thank you so much for taking the time to go through all of this. I feel like I've learned a lot. So hopefully everyone has found this really interesting. Where can we hear more from you?
I've got an Instagram, which is hopefully quite educational. There's a lot of education for GP. So Dr Ari Rafiq, and my website, drarirafik.com. I do a lot of GP teaching locally, and I'm working in a big NHS hospital trust. My Instagram is the best place. There's a lot of education about things like atopic eczema, acne, hair loss, alopecia. And I'm always happy to get messages. If people have suggestions for posts or educational content, please do get in touch.
Amazing. Thanks, Harry. It's been a real treat.
Thank you so much.